I can do a procedure that'll make a patient lose over 20 pounds in under an hour. But let's back up a little bit. One of the complications of liver cirrhosis is something called ascites. This is when the scarring of your liver causes elevated pressures in the blood vessels throughout the liver, and as a result, fluid is gradually forced into your abdominal cavity. This fluid is called ascites, and it can accumulate in pretty large quantities if untreated. Diuretics and a low-salt diet can help, but often the only way to consistently prevent the fluid from accumulating is the most direct way, draining it out of the belly with a needle. This procedure is called a paracentesis. It's a pretty basic procedure. I do it often as a GI fellow. Basically, you use an ultrasound to find a large, safe pocket of fluid in the belly, you numb the skin, and you insert a large needle. You connect it to a vacuum and remove as much fluid as you can. Earlier this week, I removed 10 liters from a patient's belly. When she went home afterwards, she was 22 pounds lighter. Imagine carrying all that fluid around. If patients are needing frequent drainage, like 1 to 2 times a week, then more permanent solutions can include a liver transplant or a procedure called a TIPS, where interventional radiologists create a shunt for some blood to bypass the liver, which decreases the significantly elevated liver pressures that cause the fluid in the first place.